I'm really grateful to the administration of the medical school for giving me again the opportunity to discuss with you some matters, some ideas about practicing medicine in a low-income country like Madagascar in southern Africa. To travel, to go tomorrow, God willing, at night, I'm traveling with a group of volunteers from Cyprus to Madagascar. We will go via Athens, and then we proceed to Addis Ababa, Ethiopia, and then to Antananarivo, the capital city of Madagascar. And this is Antananarivo, and this is the famous medical school of it was a French colony, Madagascar, and this building was this school was built in 1890 something, a long time back. So if we get the bus to reach to Lear, because the distance is about 930 kilometers, it will take us about 24 hours. So the other option, the other solution is to take the aeroplane, but we will miss all this long journey through this famous Arensept. They call it like that. And if you go by bus, you will pass in Madagascar. The people are called Malangasi. They speak the language Malangasi. Even if the country is belonging to Africa, the origination of the people is from Sumatra. They inhabited Madagascar in the 5th century after Christ. And this is the tribe of Batsileo. And the main, all the traditions, the language, the traditions, the type of food are all of them Asian. So the main food, it is rice, which is not common in Africa. So from Antananarivo, we will have to go to Lear. Is a small town by the Indian Ocean, just about 300 kilometers far from Mozambique. And this place is called Mozambique Channel. So this is Lear, in the center of the town, by drone. And arriving there, the environment is really tropical. These days, like us, when we will reach there the day after, tomorrow, it may be about 40 degrees. It is very hot and very humid. This is the famous baobab. It's one of the two symbols of Madagascar, with the lemurius, the small monkey. And this is the Unilahi River. Unilahi means in the Malagasy language crocodile, because there are crocodiles here. And just nearby the sea. Every day the sea is going around 100 meters far away, and you can walk on the sand, and you can find the calamar, octopodia, and all of these, for sure not fish there at that time. So this is Ranu, not Mafana, is the Amorfanera, they call them. So this epirogue. And discussing about practicing medicine in Africa, there are some prerequisitions you have to bear in mind. Like I didn't have it myself when I arrived first time in 1993 in Kenya. Later on, I proceeded to Uganda. I spent there 6 years. And after that, I was 5 years in Tanzania until 2010. From 2010, I'm in Madagascar. But the first experiences I realized really in the 5 years I spent in Uganda, for me, I say many times, it was like a second degree. Like I joined the university, the style of life is so different, and you have to learn the way of life of the people, otherwise you will be continuously doing big mistakes in medicine. I speak about medicine. And if we look at the environment of Madagascar, according to the Sustainable Development Goals, which are very far to be reached in general in the third world, but especially in Madagascar, the population is approaching the 30 million. But imagine, on top of the 65 years, it is just about 4% of the population. In us, it's about 15, I think. Below 15 years old is 37. Sorry, yes, below 15 years old, it is 37, while in our countries in Europe, it is very low. The life expectancy at birth is around 63 years. It's quite low, but has increased a lot since about maybe 20 years back. The population, mostly it is in rural areas, and Madagascar is the fourth poorest country in the globe. Very poor country. The literacy, they give it, they say that is 77%. I mean to know to write and read. I'm not very sure about it, because if you go to the villages, there is no school, there is no teacher. Even if somebody has completed they call it O level, which means the gymnasium for us, can be a teacher in a school, and this is a school for the children in a village. The climate is in the highlands, like Antananarivo, which is about 1,200 meters above the sea level, is temperate, but in Tular it is, as I said before, is very hot. The people are staying in huts like this, and when you enter a hut like that, you don't expect to find anything else except of some grass down there. It is soil with some grass. And these people, what is very necessary for them is to have a jerry can to fetch the water from the faraway lake, pond, river, or something like that. The life is really very hard. Imagine this lady. You see that you may think is not heavy, but it can be more than 20 kilo. And the children since they are born, let's say since they are very young, they have to work and assist the family for the cultivating the rice, like these people here, like these young people in Duliar. They are struggling to get some money to have the daily food, and these girls are just working like that. But because they are carrying, I'm showing you this in the way of the medicine view, because all of these people are suffering from so many sicknesses because of the style of life. Like these ladies here, they are cultivating the rice. It is very common to get schistosoma. This lady has schistosomiasis. We'll discuss it a bit later. It is parasitic disease, very common in Duliar. We have two types, many types really, but here we have the Mansoni, which is causing portal hypertension, and you have also a hematobium, which is causing hematuria. Imagine now, in some of these villages around this river Unilahi, it's so common, the disease, that the boys in the age of 12, 14 years old, they have hematuria. So the people, they think it is the equivalent of the period for the girls. So if a boy doesn't have the hematuria, it means he is sick. And the reason is why, because it's so common. What is the normal? What is the common? So like these girls, they are carrying now, after about sosika. Okay. So it's the main food from January until March in southern Madagascar. There is nothing else. We met these girls in this, we call it, for us we say the forest, but just this cactus. We met them and we asked them to sell us the food. They refused. Because if they get the money, what they will use it to? To eat the coins is not possible. There is nothing to buy. The place is so dry, and people are struggling. I show this photo to say that the women are the basis of the economic development of Africa. The children and the men are the boss. Okay, So you see this young girl is about maybe 7 years old. She's carrying her brother or sister on her back, because the mother is in the village, in the in the fields, working for the daily. We experience many times in Duliar every year cyclones. When cyclone is coming, it can cause a big disaster. Like last year, we had a cyclone. It was the first time to go and come. It started from Australia, crossed the Indian Ocean, came to Duliar, passed over nearby to Madagascar, passed nearby Duliar, went to Mozambique, came back for twice. So it was a big problem for that thing. So these are the reports of the World Health Organization, the annual health study, international health statistics, and according to them, we are supposed to convert to to save ways of life. Imagine these ladies in Africa in general, about about 40% of the population is suffering from the WASH. WASH we call the sickness, the diseases related to water, unsafe water, I mean, sanitation, unsafe sanitation, and the lack of hygiene, WASH. So 40%, and all of these are transmittable diseases. We will see them again. And imagine now, this photo is from Antananarivo, the capital city. So these people, what are they doing there? The women have, they went, they are washing the clothes. You see that they put them, they are fetching water. They are also, I don't know, he's fishing probably. Everything is done in these small rivers and ponds. And for sure the water is dirty. And from this water, like these ladies, they don't have a washing machine. They went there to wash the clothes. And this lady doesn't have running water in the hut, so she's bathing the child there. The conditions of sanitation access have only 12% of the population. This is a toilet in a village. In the villages, the condition, I think, are much better than the town, because Antananarivo has about 2 million population. The conditions, the hygiene conditions are very bad. This is an open market butchery. In Tuliar, when it's raining, is like that. Access to improved water, drinking water, I mean, has only 22% of the population. The majority, as I shown before, they go. Also, this is from Antananarivo. So they go there. They just wash the clothes. They take to drink and for any other use the water. If there is a river, the water is quite clean because it's running water. And you see this boy here. I had this photo when I was a few days back in Madagascar. He's thirsty. He take the thing. No glass, nothing clean. It depends now if they have fetched the water from the river. At least it's a bit okay. Otherwise, if we manage to open a borehole, it is, myself I say many times, it's good to open a health center, a health facility, a dispensary. But if you open a borehole, you prevent the first cause of death in children under 5 years old in Madagascar, in general in Africa. It is diarrhea due to dirty water, so, and dehydration. So if you manage to open a borehole, it will be for sure a big assistance. The Orthodox Diocese in Duliar is struggling for this. This borehole was open, the expenses were given from NGO IHA. It's a humanitarian agency NGO in Cyprus with President Bade Vasilios in Agia Napa. And they are donating the money, I will show you, for the clinic, but also for all these projects. So this borehole, it is there. is about 17 years depth, and there is a solar machine which is sending the water up there, and the whole area has free clean water. The immunizations are a big problem in Africa. People, not only because they are not easily available, but because people, like now in Europe with the corona, there is a long time back the story that they don't want to do the vaccines because they got the idea, some politicians even spread the idea that the vaccines cause the HIV in Africa. There are many confusions around these matters. Somebody may laugh about it, but it is something which you have to struggle to modify it, to change it. So, what do you call it? For measles, very low the immunization, and it's a big problem. It's the 5th cause of death of children in Africa, the measles. When you have epidemic of measles, it's a disaster. About 40% of the children are chronic malnourished, because when we say standing, it is the height for age, and about 40% of the children are malnourished. Acute malnutrition is wasting. It's about 7% of the children, and many of them have avitaminosis and anemia for sure. Their food mostly are carbohydrates like rice. Very rarely they will use protein from like fish or eggs. And some of the staple food they are using, like cassava, manioc. This is in Greek they call it artodendro. I don't know why they call it like that one. They consume both the leaves but also the roots, mostly the roots. But this one has cyanides. So from this you may get a goiter. When I'm in Cyprus, in Greece, they are discussing, he has a nodule of 5 millimeter. There's the other one saying, no, it is 3. And they are bargaining, what is the size? Here there's no problem to say, she has such a big goiter and it's so common. Women in reproductive age are suffering from severe anemia, very common. The density of physicians is about 2 per 10,000 population. And for dentists, don't think about them. In the villages, they have never seen a doctor, and for sure they have never seen a dentist. Only 3, also the nurses are very few, and the midwives also. And this is the University Hospital of Tulear. This one here. Ramadini came there, she's laughing now. And imagine now, during the cyclone of last February, this is the pediatric ward, and they requested the diocese to assist them for renovation. In Tulear, when you arrived there, in the outskirts of the town, like the environment is changing slowly, you will arrive at the Centre de Santé Orthodoxe, l'Annonciation, in Betanimena. Was built in 2010, a small clinic at the beginning, and in 2015, the NGO International Humanitarian Aid Mother of God Cyprus taken the responsibility for the expansion. They have sent up to now many containers. One of these, the Father Vasilius is very well organizing the things. He received soldiers from the army to load the container. It's a big struggle to load the container, first of all to collect the material. And thanks God we have really many supporters. The Ministry of Foreign Affairs, OKP also donated to us a lot of things which were to go for recycling. and many other, I mentioned many times the University of Nicosia. I will show you later the laboratory was organized with furniture were donated from the university, who have been for recycling, I think. So the container arrived there, but due to the, I don't know, Paleria, the sea going out. Yes, the thing you see, yourself you don't know, but myself, I have learned these things. The boat is supposed to be 2/3 in the sea and 1 outside. Here is the opposite, because the sea has gone, and the whales are coming from southern, from Notio from Antarctic, to give birth from July to October. Every year, but because of the sea, sometimes they stay outside, but the people, they go and they push them to go back. And the container arrived. Finally, we managed to receive it, and the clinic has been organized with the material sent from Cyprus. We receive many people per day. This is our staff. We have 4 doctors. We have what we call a doctor biologist. Very rare to find one. We have for the echo, and nurses in the pharmacy. We have about 26 people staff. All of them, they are paid from NGO IHA. All the patients who are coming here are paying nothing. All the services are for free. I mean, consultation, medicine, lab tests, echo, everything is free. But we can receive per day around 100 patients online. Each doctor, 25 patients per day. There are 4 doctors, 4 generalists, and then all the urgencies, which means about 20, 25. So totally, we receive about 3,000 patients per month. But they come much more than that, and they come on foot, by cyclobus, like this cyclobus. They come, many of them, from the previous night. They sleep outside the clinic to take the line for the next morning. And they are coming from very far, many of them. And they are waiting there in the morning to be online, to be received. This is the reception of the clinic. They are waiting there to be registered. And then they have to go for the vital signs, the temperature and all that, like this. And then they go to the doctor. After the examination, if they need to go for any injection or any minor, what we call surgical procedure, and then they go to the pharmacy. For them, it's a big benefit having free access to medicine. We have a list of medicine, the essential medicine, which for adults and children. The characteristic of this medicine is that, I mean, for antibiotics, it is the first, maximum the second generation usually. Except there are some exceptions for that, but you will not find this third, fourth generation cephalosporins and all those things. And this is our laboratory. These are the furniture donated by the university. We have automatic hematology analyzer. We have also ELISA, because we have a lot of patients, as I mentioned before, with schistosomiasis, cysticercosis, which are diseases which you need for. If we manage, God willing, to organize PCR, it will be a great improvement. We have the echo. We have a new machine now, and this X-ray machine, this X-ray department was organized recently, and it is a big assistance for the patients there. Now we are reorganizing the dental unit. We received a new machine from, and it's a donation from a dentist from Cyprus, and we are now to inaugurate. In the clinic, we receive a lot of students. These are the 6th-year students of the medical school of Tulare University, and they are coming. I teach them myself the ECG, electrocardiogram, BLS and ALS, and also like here we have these how called dolls, mannequin have been donated to us from Famagusta Hospital. They were useless there, but for us, Professor Riel told me that is the second doll, mannequin, in Madagascar. There's only one available in the Association of Emergency Medicine in Antananarivo. These are students of nursing schools. They come quite often. We receive them. We try to train them as much as possible there. These are our results. I could not spend time for that. And on the other hand, we have a free malnourished children baby milk project. We have more than 530 children now. Up to 6 months we distribute milk, powdered milk, and the ones above we have another malnourished what you call multivitamin porridge called Kupa Aina. In Malagasy means the source of life. They are coming, these ladies, twice a month to get the milk or the porridge for 2 weeks. They are waiting there. We have the staff which is responsible. The children have their card. They have to be weighed, measured in kilo, but also we use this thing of World Health Organization. It is a special way to check the malnutrition. If the thing is in green, it's okay. If it's in yellow, it's borderline. If it's go to red, it means it is malnourished. It's a very way, now like this child is malnourished. It is red, the color there. It is, we call it BP, is the middle circumflex of the brachial cell. We give the milk. We have a very good cooperation with in general with the government services, but especially with the health and public health system of Madagascar. We donate them equipments like these dental machines or consumables or medicine which are not necessarily useful for us. Like they donated to us a mammography, and we donate for us. We forwarded to the University Hospital in Tulear. We are organizing now 2 dispensaries. One is in Ambaskibu. It's about 100 kilometers from from Tulear. We have I don't know what happened now. We have we bought now. Κάτι έκανα τώρα εδώ. We bought now a car we bought a car which will be carrying the doctor and the nurse and the pharmacist twice a month in each of the 2 dispensaries we are opening. When it's possible, especially when you receive some volunteers, doctors, nurses from abroad, we go to do a mobile clinic. We have to carry with us all our equipments and all the medicine necessary. There is nothing there to find. So you have to pass in villages like these roads. This is the Bishop of Tulear, Bishop Prodromos. He's from Greece. We have to arrive there. The people are very happy. They are assisting for the transport of the medicine. The patients are coming by sareti. This is the sareti on foot. Many of them are so sick that the doctor has to go on the sareti. Dr. Kyriakos, he's from Greece. Now he's a prosopikos iatros in Cyprus. And the people are gathering there, waiting for a long time to be examined by the doctor, to register and be examined by the doctor, to receive their medicine, and be happy and go back home. For some of them, this mobile clinic may save their life, because if they are suffering, let's say, from malaria, nothing is in the village. If the child has dehydration, just giving him Almora, ORS, oral rehydrated salts, you may save his life. It is painful that the children, and especially in general the people in Africa, they die because of treatable or preventable diseases. Many times they express their what you call they are giving, like this poor man came back. There was a group from Cyprus, these volunteers, to give his kuku, they call it kuku, τον πετινό, as a gift. Continuing with this, what we call sustainable development goals, we mentioned that the average, the life expectancy is 65 around. Imagine now, we are still in so high maternal mortality ratio, 392, while the target for 2030 is 70. No way Madagascar to reach that point. Okay. So, and if you look at the only half of the what you call of the births are attended by a skilled person. We don't speak about a mea. I speak in general about somebody, a lady who has been trained a bit and knows some things very low. And for me, when I receive a baby, 3 days old, I will not be checking if he has, with fever I mean, there is nothing else to do. You just open his clothes, whatever. You will find the umbilicus full of pus. Because they have tied it, when he was born, they tied with something what they find, infection, the child is coming with 40-degree Celsius, and for sure he will die. The important diseases of the children of Africa are pneumonia, diarrhea due to dirty water, malaria, injuries, and all of them, measles also is there, and all of them are preventable or treatable disease. For the children below 1 year, 12 months old, the mortality is still very high, and is due to prematurity. That one you cannot do many things. When I visited in the university hospital, I show you some photos in Duliar. They asked me to go to the kangaroo unit. It is the intensive care for newborns. The kangaroo, they call it like that. It is supposed to have a stable temperature, and everywhere was open. I mean, it's unbelievable. They didn't have oxygen. They asked us to assist them with some cylinders of oxygen. And sepsis is among the, and you see this child came to us, it has infection of the umbilicus. We have what you call in adults in general, the big problems is tuberculosis, HIV, malaria, and these neglected tropical diseases. There is a list of diseases. Okay, I pass, pardon. Is a list of diseases who are very common, prevalent in the tropics, between the Tropic of Cancer and the Capricorn, and they are due to tropical environment. There are multiple infections many times, and they are associated to poverty. Just some of them, like dengue and chikungunya, echinococcus, we find in Duliar, trematoses like ascaris, leprosy. It's a patient I faced myself with leprosy, filaria very often. Onchocerciasis is going to be finished out, we expect soon. Rabies, it is there. Schistosoma, as I mentioned before. Geoelmithes. Cysticercosis is a big problem in Duliar. Many times when you receive a child, maybe 5 years old, with epilepsy, you have to think immediately about cysticercosis. It's a parasite which is they get it from the not well cooked pig meat, and is transmitted in the human body. It goes to the brain, is causing an occupying lesion, space occupying lesion, and due to that he started having epilepsy. So without having CT scan, no MRI, you don't speak about MRI, without having EEG, just with only clinical indications, you don't treat only the epilepsy with phenobarbital, but also you give the medicine for the cysticercosis, and you may give him a permanent solution. trachoma is there, and many other. For sure, the chronic diseases are there, and they are increasing slowly because the average life is increasing also. So we started having, we have been having, but they are increasing the CVD, the cardiovascular diseases, cancer, diabetes, chronic respiratory disease is very common due to the what we call the breathing of the when they are using the charcoal for cooking. And have some ideas about the environment, the clinic, the patients we are receiving there, we are coming to discuss a bit what is tropical medicine. There are different names. This is the first edition, the famous first edition of Sir Patrick Manson, 1898. This is the 24th, I think, edition of this book, and who described the diseases of the tropics. And for sure there are other books, like very useful one is this one here, of in Europe, especially in the countries who have been having colonies, like UK, France, Belgium, Germany, I think not so much. They have well-organized schools and also centers, hospitals for tropical disease. In UK is very well known, the London School of Hygiene and Tropical Medicine in London, and the Liverpool one is very famous. And they have other, they call it tropical medicine, medicine in the tropics, medicine in low-income settings. I don't think it's very important, that one. But what is the meaning of this, of tropical medicine? Is the medical, not specialty really, of the branch of medicine dealing with tropical diseases which are uniquely or prevalent or more difficult to be controlled in the tropics, and mostly are parasitic diseases. I pass this one. And we share them in communicable and not communicable diseases. I will show you. This is for sure. Do you understand? This is a case of herpes zoster, and this is ameloblastoma. Very, very common in. Is an undifferentiated. Not tumor. It is a tissue developed. We don't know why, but it's very in Tulia. We have many cases like this. Mostly, as I said, are communicable diseases which are viral, rickettsial, chlamydial, bacterial, fungal, and parasitic, which is equivalent to tropical diseases. Protozoal, but mostly helminthic. Also, arthropoid are causing all of these, some of these diseases. From the other side, non-communicable diseases are as usual for us, but there is a difference in prevalence and incidence of those non-communicable diseases. We have malaria, tuberculosis, HIV/AIDS, pneumonia, meningitis, STIs, and neglected tropical diseases. On the other hand, we have cerebrovascular accidents, cancer, diabetes. Accidents are very common, and the chronic pulmonary diseases. Among the communicable, I don't spend your time for this. I'm just showing you to know how big is this catalog. From viral, HIV and hepatitis, Ebola, dengue, influenza, yellow fever in some countries is very important. Measles is everywhere, rubella also. From bacterial, pneumonia, typhoid, a big problem, very big problem, especially the treatment of typhoid. We have a very big problem with the antibiotics. When I arrived myself in those years in Africa, cotrimoxazole, ampicillin were very active, very useful. Soon they became useless, resistance. Then it was ciprofloxacin, has gone, and now it is only ceftriaxone and cefixime. And unfortunately, there is overusing, and very soon will be a big also problem of resistance. We We have pneumonia, typhoid, meningitis, brucellosis is there, anthrax, tetanus. I have seen tetanus myself. Plague is endemic in Madagascar. We have some, not epidemics, but in some areas there is a big problem there. Gonococcus, diphtheria, tuberculosis is a big public health problem. Leprosy is there, not so much. And the tropical diseases are protozoal, hermithic, and anthropoid. And among them, very big problem also is endemipa, causing dysentery, Giardia lamblia, giardiasis. Trypanosoma in Madagascar, not so much. Leishmania is there. Malaria is everywhere in tropical countries, and toxoplasmosis also. But if you go to the helminthic infections, are schistosoma, cysticercosis, we mentioned it before, echinococcus, ascaridiasis is a big problem. When I was in Bukoba, Tanzania, I received a patient with gangrene. He was diabetic. He had gangrene. And a group of doctors came from Greece who have been together. The patient started having thinking, why? What is the problem? One professor told me he has sepsis. And he was in sepsis. Suddenly he vomited, and he brought out an ascaris 70 centimeter. And after that, the mother is coming and is telling you, my child is at night, is coughing, and is bringing out, they know the names, or they describe it, the rose worm. You know, they know these worms, these parasites, they have a circle, they are ingested, they go to the stomach, they penetrate, they go via vena cava, they cross in the lungs, and at night when somebody is sleeping, especially the children, they go to the trachea, they can bring it out, either from the nose or from the mouth. And scabies is becoming a huge problem now, a very big problem now. We have many, many patients, especially in the villages, with scabies. Just to give you some examples, Miasis, when I was in Kampala, Uganda, one day they brought me a baby. The parents were refugees, either, I don't remember, from Burundi or Rwanda. And I saw the child, the baby, was having like bimbo, they call it. I say, what is this story? But I was assisted by the lab technician. He was very experienced. He told me, and finally what it was Miasis. It's flies. And when the place, especially the skin is dirty, they inject their eggs, and then the new fly is starting to grow. It is like a small worm. And then myself, I didn't know what was the treatment. The treatment finally, I found a way by a needle to take them out. But the solution, the best solution, is to put Vaseline. Why? Because where they enter is the hole where they breathe. They take oxygen. So if you cover it with Vaseline, they come out. This is very important for tropical medicine, the way of transmission. In last August, I had a big problem with a group, really with a pediatrician, a group of pediatricians came from Greece. Among them, the leader was trying to show that she knows everything there. Myself, I kept quiet. So we received a child with his mother, I don't remember, girl or boy, having finally it was chickenpox. Herself, later on, started saying, we have a case of monkeypox. I told them, okay, be careful. We have to be thinking very well. In epidemiology, there is, to say that we have an epidemic of this transmittable disease, you have to find the line. You have the final case now, you have to go to find the chain from where it came and to find the source. So, we are in Duliar, Madagascar. The how you call it? The monkeypox cannot fly over the Indian Ocean 300 kilometers and come to Duliar. It's not possible. So the only solution is to come by airplane, somebody, to Antananarivo, cross all the country. It's not possible not to transmit anybody on this way, and then come to Duliar and spread the thing. How you come to tell me in Duliar, in a small town, in a rural village, there you find this case? I mean, always you have to think, because you can cause a huge problem. She went back to Greece, she spread the things on internet, and then the country was possible to be on the list of World Health Organization that has this problem. It means that all the tourism of Madagascar will be destroyed. I mean, medicine is a responsible, and you know that. I'm just telling you how you make some people, they come with the intention to assist, but they can cause a big problem. So the diseases who are water-borne are very, very important. The other ones, like with the soil, with food, it is not so much. And also vector-borne diseases, tropical diseases are important. This lady has portal hypertension. She has schistosomiasis. The first cause of upper GI bleeding, for us it is maybe ulcers, or not so much now, maybe the use of anti-inflammatory medicine and this and that. In Madagascar, the first, especially in Duliar, if you have somebody bleeding, he has what you call vomiting blood, you have to think about schistosomiasis. So this is the case of this lady. She has schistosomiasis. She developed, for those who knows anatomy, it's not possible to have, this is portal hypertension, when you have the veins like that. But it's not common to have the veins coming from upside down here. So because myself, I was having the problem if she has varicose veins, or it is, this one is what do you call that one? It's another way of the blood to bypass, like doing drainage. This is another case. This man, I have this one from Uganda, and I have shown many times this photo. This is filaria. This lady came, she has been having some nodules. One doctor from Cyprus insisted that she may have filaria. I told her, leave this story now. We have a lot of patients. We don't have time to be dealing with filaria. Finally, when we opened it, it was a filaria, like that. Small. Imagine this lady has been having so many worms under her skin, everywhere. This is ascaris. This is a case, I was just, one of our doctors sent it to me these days. This is scabies. You know, when you have scabies, you have itching, and then you have staphylococcus. It's very common to have a combination of scabies with staphylococcus. This is prolapse, and this is staphylococcus also. This child, we find it in a village. Then we ask them, you know, they are like this. They are not like holes only. There is thing going between under there. There are like what do you call tunnels there. This is chicken pox. Okay, I have seen that one. This one is a tip mycosis, fungus disease. It's very common. Not this type like this one, but in general, this is also scabies, general scabies. This is fungus. This is a type of elephantiasis. I will show you at the end that the diagnosis is clinical. It's not easy to confirm it with laboratory, which is very important really. This is also mycosis. Mycosis is a fungal disease, extended. This cannot be treated with what you call with creams and this. You have to take orally the medicine. I want just to mention that among the non-communicable diseases, the chronic diseases, hypertension is very common and very important. Pneumonia, respiratory tract infections, anemia, very, very important. Diarrhea, dehydration, diabetes is going up. Goiter, osteomyelitis is a big problem. Otitis media. You may find many children deaf because of chronic otitis media. I received one lady, one mother with a child. The pus was coming for 1 year out from the ear, and she thought that is okay. She didn't understand that it's a big problem because the child became, after that, became deaf. Malnutrition is there, and so, we have hereditary diseases like here you have albinism, meningocele, hydrocephalus. This is neurofibromatosis. This child passed away. It's the same one. Hypertension is a very common problem in Africa in general, and causing heart failure and many other complications. Pneumonia, asthma is also common. Chronic obstructive airway disease. If you manage to do what you call an X-ray, you will find a lot of problems when it's possible to do it. Otherwise, you may start treatment for tuberculosis just like that. I mentioned to you about the possibility of ameloblastoma, but for this case, you have to think about also about Burkitt lymphoma. Malnutrition, dehydration. This patient also passed away. Imagine now for this ascites, like this lady. This is a very also common skin disease, fibroid. Is the tendency of the skin of the people to do fibroid tissue who become very big. This is a patient with pemphigus. When you see like this, we have to think about also deep mycose, fungal diseases, fungal disease. This patient was a young driver. Was driving a taxi bus, a small bus. He went to the village. He has been having malaria, or they thought he has malaria. They give him a quinine injection, and due to that, this is not infection, is a a tissue reaction to quinine. Quinine, you know, even if you myself, I don't think I have ever given it IM intramuscularly, because you can, even if you do it the perfect way, chemically can cause damage of the sciatic nerve, and the patient will be paralyzed. This man, I don't know what happened after that, because he came to the clinic, but he has been having a big inflammatory reaction of the femoral area. This was a young girl, about maybe 4 years old, with a gangrene of both legs and also of the hand. At that time I conducted a pediatric rheumatologist in Cyprus. She was from Greece, I remember, and she guided me. Finally, the child thought about vasculitis, but if it was vasculitis, it will not be improved. Maybe it was an infection, but the child it was okay. Nephrotic syndrome is common in Africa due to not only glomerulonephritis but also malaria. We have thought about it. Like I showed you this photo before, and I say that many of these ladies very soon they will be having osteoarthritis because they are carrying on their head 20 kilos now. So very often, this is a lady with cancer of the eyes. This one. This girl has been having a tongue abscess. It's another case. Many skin disease, malnutrition in the form of kwashiorkor or marasmus. This lady came. She has been having finally a fibroma of 8 kilos. So, and then I don't have the photo of another one we received late, we found in the village recently, with, I don't remember, maybe 6 HB hemoglobin, because she has been having menorrhagia due to the fibroma. We have a good cooperation with some of the doctors in the University Hospital. Professor Johnny is a professor of surgery and the dean of the medical school. We refer this patient and we pay for our surgery. I mean, the clinic is paying the cost of what you call for the fees for the operation, staying in the hospital. This is a case of cancer. This lady like that, and imagine, I will show you another one. This is This also she passed away. She has been having osteosarcoma. But the only solution for her, they advised her to be amputated. She refused it. Imagine this boy, this man, young man, was imprisoned maybe last year, the other year, 23. So now he has what do you call this? Has been having a lot of time the hernia, and they like that. They just kept him there, and he was to die. And finally, we referred him to the hospital, and he was operated. This lady has a huge, what do you call, hernia. This patient also came with thought about vasculitis. He doesn't have diabetes. He was the left leg, lower limb was amputated, and this one is dropping. Every sometimes a piece is dropping, is going off. So vasculitis can be a cause. And imagine, for those who knows about microbiology, we are not able to do antinuclear antibodies. Even in Antananarivo, we are supposed to send the thing. Now in the clinic we are struggling to organize in the laboratory to be able to do, which is an important test, that one. This is ameloblastoma in a child. This was the girl I showed you before. Coming to etiology, many times it is a common, like in Western people, but there are also some genetic factors, like in hypertension. We know that the incidence and prevalence of hypertension in African people is double compared to Western people. And not only that, pathophysiology is very important, because we know that is volume dependent. So which means the medicine of choice, it is diuretic, not ACs like we use first line among others in our place. As far as you are not able to do a lot of lab tests, X-rays, forget the MRI, you have to be based on clinical thinking to confirm the diagnosis. And the solution for that is to do a syndromic approach. Syndrome is a usual combination of signs and symptoms. So we have the febrile patient, the patient with fever. We have the diarrhea, many causes. You have to find the way which one can be the cause. I will show just immediately after that about it. Anemia. You have to think the causes, you cannot prove them, so you have to treat all those which you are suspecting, which are treatable. It's very, very important, this point. And the splenomegaly, it is very also common. You can find the splenomegaly, we speak about a spleen up to 20 centimeters below the left costal rib. This was a young man with a huge pleurisy, xanthelasma. So this man was having urinary retention. When I managed to pass a urine catheter, I think it was about 6 liters. And it's not very rare in men. This was not what we call prostate hypertrophy, it was due to schistosoma. But this lady came just recently when I was in Tular. Imagine now, she has been having, when we removed it, 7 liters of urine before and after we passed the catheter. And you have to be slowly, you know that one, you may collapse. And not only that, you may have a hemorrhage, in the urine. So you have to be careful. And for that one, this one, what did I know? For this one, you have to suspect the schistosoma also, because a woman, why to have retention is very rare. This child has nephrotic syndrome, and this is a uterus problem. And when I was not there when this lady arrived in the clinic, and they sent me this photo. Imagine, it's like a crater. It's like you cannot think that it's possible a lady to reach this point, and it was like that. I'm not sure that is cancer, because she's in a good health. I mean, you see, she's not having a cancer like that. She was supposed to have metastasis, lymph nodes. But unfortunately, we didn't see the patient again. So, lacking lab and imaging investigation, you have to be based on clinical thinking. So, you have to make this syndromic approach, a syndrome, for patients in tropics, but also for patients who are coming back. And because now, as you know, you have the traveler medicine. It's what you call a branch of medicine dealing with people who are to go or coming up from tropics. So you have to follow a syndromic approach, but also a region-wise probability, which means in Madagascar, you don't have to think about fasciola hepatica, because it's not there. Fasciola hepatica is in Asia. It's a tropical disease. So you have to be knowing what is the local epidemiology. And the four main syndromes you have to be dealing is fever, is neurologic syndromes, especially seizures, dermatologic syndromes, you saw many of them, and diarrheal disease. And these are related to the disease, the decision, I mean, to how common is in the area, but also to the related tests which have to have some special indications for the patient. Finally, having to conclude with the diagnosis to decide about the treatment, you follow this approach of syndromes, which means you have to say, what is the problem of the patient? He has urethral discharge. Okay, this is STI. What can be the causes? Gonorrhea and chlamydia for the man. So what is the best solution? Is to do the examination. It's not available, so what do? You have to treat both of them. Dysentery is acute bloody diarrhea. It can be bacillary or amoebic. The best solution is to do the stool analysis. If it's not available, you have to treat both of them. And I'm very fond of this integrated management childhood illness project, IMCI of WHO, because it's really a very helpful tool to approach the children in Africa, where you don't have all these laboratory and investigation facilities. I'm just showing to you that some what you call signs or symptoms, we call them pathognomonic. When you have it, there is no other what you call possibility. Like when you have prognathism, like this man, you know that is acromegaly, and you know that the problem is coming straight away from the hypophysis. But this is a case of psoriasis, and also this one. Like this case, you don't know. It was a Greek origin man. He passed away also. He came. His children brought it to the clinic. He has been having a huge lymph node block, and bubonic lymph. So there can be lymphoma, can be many other. It can be Haemophilus ducreyi. It can be LGV, sexually transmitted diseases. So if you don't have the solution, the option of investigation, you have to treat. Of course, so it's not easy to treat somebody for lymphoma, but at least for the common and easily treated diseases, you have to do it. What is the advantage of this approach? Is problem-oriented. I mean, the syndromic approach is problem-oriented. You can do it in primary health care, and is highly sensitive. You will get the solution for the most of the severe problems. What are the disadvantages? You over-diagnose, and especially you over-treat. That is a big problem. You have to treat for this, for that. Very soon you will have what you call resistance, because you over-treat. Especially this happens with malaria. Because you receive somebody. Myself, I go to a village. I have a young child with a fever. I check, I examine, I don't have any indication to say it's pneumonia. I had that experience. Once I treated the child for for malaria, because now we have TDR, this rapid test, and this is very useful really. But at that time it was not available, so I was not having any sign or symptom for pneumonia. I treated for malaria. After 2 days, the mother brought the child in a bad condition with pneumonia. It was pneumonia from the beginning, but so the problem is that you do over-diagnosis and over-treatment. You cannot find the asymptomatic, and myself, I mentioned many times, is good what you call as evidence-based medicine. Now we have reached the precision medicine, but in this environment, in low-income setting environment, you have to be problem-oriented medicine. This is the I don't want to spend your time. Is this childhood IMCI program? It's an approach to check the severe possibilities the child is suffering of. If he has, let's say just one example, if he has what we call cough, difficult breathing, you have to rule out pneumonia, which is the most dangerous disease for him. Coming to the end, the treatment, the prognosis, it can be as usually in our environment, but there are also some differences. Like the majority of the tropical diseases are preventable or treatable. And you have always to follow the national recommendations and guidelines. The guidelines, the international, are good, but sometimes are not fitting in the environment. The chronic illnesses are a big problem, and never forget traditional medicine. Myself, when I arrived in Africa, I just herbs, nothing. But some of them are very effective. One. Second, I was influenced by a report of WHO, World Health Organization, say that when you go in these countries, you have to respect the health system who assisted the people for centuries. Okay, and now the first line medicine for malaria are the products of artemisinin. Artemisinin is a medicine, it's a traditional medicine, herb in China for centuries. Then Novartis came, got it, and prepared the original medicine, and now it is the first line medicine for malaria. So you have to think that, you have to know that the herbs are effective, one. Second, can be harmful. Maybe it was not useful for the patient, but he caused him a liver damage. Very often, because of this, there is no titration. They tell them, go collect them, boil them with water, but how much water you put? So there are so many problems there. I want to show you this strategy of World Health Organization to eliminate all of these what we call non-tropical, neglected tropical diseases. Why? Because it's a long time back strategy, and you will see that is preventive chemotherapy, is intensified disease management, is vector and intermediate host control, which is a big problem due to the climate change. You know that many of the arthropods, like mosquitoes, even of these ticks, now I saw that probably they expect one of the pandemics can be due to one type of tick, which now is increasingly expanded in Western Europe. This thing is in a high temperature, but because the thing is changing, it can be a problem there. And this holistic approach of the human being with the environment, the animals, the trees, everything in his environment, and we call this one as we approach this matter as a very important way to eliminate these entities, and for sure to provide water, sanitation, and hygiene. These are the herbs, very common in Duliar. And this is my last video, and I give you